Welcome to another video of Clinical Parasitology Unit-4, first video. Urine, collection, preservation, and transportation. Collection. Types of urine samples. Random sample, collected at any time, used for routine screening. First morning sample, most concentrated, ideal for pregnancy tests and microscopic examination. 24-hour sample, measures substances excreted over a day, e.g., creatinine clearance. Midstream clean catch, used for culture to avoid contamination. Preservation. Methods. Refrigeration, 4 degrees Celsius most common method, delays bacterial growth. Chemical preservatives, e.g., boric acid, for microbiology, toluene, prevents bacterial growth, formalin, for cytology. Prompt analysis, ideally within 1–2 hours after collection to avoid deterioration. Transportation. Use clean, sterile, leak-proof containers. Label with patient's name, date, and time of collection. Transport to lab promptly, ideally within 2 hours, or refrigerate until transport. Method of examination of urine samples. 1. Physical examination. Color, normal as straw to amber. Appearance, clear, cloudy, may indicate infection or crystals. Odor, fruity, ketones, foul, infection. Volume, normal 620–500 ml/day. Specific gravity, normal 1.003–1.030. pH, normal 4.68.0. 2. Chemical examination. Performed using reagent strips, dipsticks. Albumin, protein, indicates kidney disease. Sugar, glucose, suggests diabetes mellitus. Ketones, seen in diabetes, starvation. Blood, indicates trauma, infection. Bilirubin and urobilinogen, suggest liver disease. Nitrites and leukocyte esterase, suggest urinary tract infection, UTI. 3. Microscopic examination. Sediment after centrifugation is examined under a microscope. Cells, RBCs, WBCs, epithelial cells. Casts, hyaline, granular, cellular. Crystals, uric acid, calcium oxalate. Microorganisms, bacteria, yeast, parasites. Special urinary constituents. Constituent significance. Albumin indicates kidney damage or proteinuria. Sugar, glucose, suggests diabetes mellitus if above renal threshold. Bile salts present in obstructive jaundice. Urobilinogen increased in hemolytic jaundice, absent in obstructive jaundice. Porphobilinogen found in porphyria. Chyle milky urine due to lymphatic obstruction, e.g., filariasis. Bence-Jones proteins associated with multiple myeloma, precipitate at 40–60 degrees C and Reedy's solve at 100 degrees Celsius. Cerebrospinal fluid, CSF. Constituents and normal reference values. Appearance, clear and colorless. Protein, 1545 mg/dl. Glucose, 4080 mg/dl, roughly 2/3 of blood glucose. Cells, 0.5 WBC/mm superscript 3, mostly lymphocytes. Opening pressure, 71–80 mmHg. Method of sample collection. Lumbar puncture, between L3–L4 or L4–L5 vertebrae using sterile technique. Collected in 3–4 tubes. 1. Chemistry/serology. 2. Microbiology, culture. 3. Cell count. 4. Optional for special tests, e.g., cytology. Examination. Protein, sugar, chemically tested. Cells, counted using a hemocytometer. Microorganisms, gram stain, culture, PCR if needed. Body fluids, transudates and exudates. Definitions. Transudate, due to systemic causes like heart failure, low protein content. Exudate, due to local inflammation or infection, high protein content. Differentiation criteria, Leitz criteria. Exudate if one or more. Fluid protein/serum protein 0.5. Fluid LDH/serum LDH 0.6. Fluid LDH 2/3 upper limit of normal serum LDH. Normal reference values. Protein, transudate 3.0 g/dl. Cells, transudate 1000/mm superscript 3. Appearance, transudate clear, exudate cloudy or bloody. Method of sample collection. Thoracentesis, pleural fluid, paracentesis, acidic fluid, pericardiocentesis. Use aseptic technique, collect in sterile containers for chemistry, culture, cytology. Examination. Protein, sugar, chemistry tests. Cells, total and differential count. Microorganisms, gram stain, culture, acid-fast staining if TB is suspected. MCQs. 1. Which of the following is the best sample for urine microscopic examination? A. Random sample. B. First morning sample. C. 24-hour sample. D. Midstream sample. Answer, B. 2. Which preservative is commonly used to preserve urine for culture? A. Formalin. B. Boric acid. C. Acetic acid. D. Toluene. Answer, B. 3. The normal range of urine-specific gravity is A. 1.000-1.010. B. 1.010-1.020. C. 1.003-1.030. D. 1.020-1.040. Answer, C. 4. Milky urine is commonly seen in A. Diabetes mellitus. B. Jaundice. C. Filariasis. D. Nephrotic syndrome. Answer, C. 5. Bence-Jones proteins are found in A. Diabetes. B. Multiple myeloma. C. Renal failure. D. Hepatitis. Answer, B. 6. Which of the following urine constituents gives a positive test in porphyria? A. Bile salts. B. Urobilinogen. C. Porphobilinogen. D. Albumin. Answer, C. 7. Which stain is commonly used for detecting bacteria in CSF? A. Wright's stain. B. Giemsa stain. C. Gram stain. D. Ziehl-Neelsen stain. Answer, C. 8. Normal protein concentration in CSF is A. 0.15 mg/dl. B. 1545 mg/dl. C. 5100 mg/dl. D. 100-200 mg/dl. Answer, B. 9. Which of the following differentiates transudates from exudates? A. Glucose level. B. LDH level. C. Specific gravity. D. Leitz criteria. Answer, D. 10. The normal glucose level in CSF is approximately A. Same as blood glucose. B. Half of blood glucose. C. 2/3 of blood glucose. D. Double the blood glucose. Answer, C. 11. Which body fluid is collected by thoracentesis? A. CSF. B. Pleural fluid. C. Acidic fluid. D. Synovial fluid. Answer, B. 12. Which urine test indicates a urinary tract infection? A. Protein. B. Nitrites. C. Ketones. D. Glucose. Answer, B. 13. Presence of bile salts in urine gives a positive A. Benedict's test. B. Hayes test. C. Sulfosalicylic acid test. D. Fouchet's test. Answer, B. 14. Urobilinogen is decreased in A. Hemolytic anemia. B. Obstructive jaundice. C. Hepatitis. D. Cirrhosis. Answer, B. 15. Which type of cast is normally found in small numbers in urine? A. Granular. B. Fatty. C. Hyaline. D. Waxy. Answer, C. 16. The best method for detecting Bence-Jones protein is A. Dipstick test. B. Heat test. C. Electrophoresis. D. Benedict's test. Answer, C. 17. Which of the following is a feature of exudate fluid? A. Clear appearance. B. Low protein content. C. High LDH. D. Few cells. Answer, C. 18. A sample of CSF should be transported to the lab. A. After freezing. B. After adding formalin. C. Immediately at room temperature. D. After refrigeration for 24 hours. Answer, C. 19. Which of the following is tested using sulfosalicylic acid? A. Sugar. B. Ketones. C. Protein. D. Urobilinogen. Answer, C. 20. Microscopic examination of urine helps identify A. Color. B. pH. C. Crystals and casts. D. Specific gravity. Answer, C. Thanks for watching. Subscribe the channel for more videos.